Keeping you informed. This is In.form on WBDC and 18 WJTS.
Did you know that the month of May is Speech Language Hearing Month? And with that, I'm joined in the studio with two very special guests from Salience. Please welcome Katie Warren and Katherine Paulin. First of all, welcome to the studios.
Thank you.
Thank you.
Very big month for speech therapy. Now, I know nothing about this, so I'm very interested to find out more. First of all, let's start at the top. You guys are both speech language pathologists. What is a speech language pathologist?
Well, that's why we're here. We work with a variety of things, and the name does not truly describe all that we do. So
I think there's a lot of titles like that.
Yes, yeah. So we came to kind of educate the public on all the things that speech therapy can do for them. So one of those is swallowing, right? We work with swallowing. Sometimes after you have a surgery or a medical event, you have difficulty with swallowing your foods or liquids, coughing. And so we work with those muscles to try to strengthen those.
And I think a lot of people out there don't realize how crazy the brain is and how many things can be affected. Now, let's say you're in an injury or maybe you've had a stroke or things like that. And things that we take for granted, swallowing, one of them, is something that your brain, I don't know how to describe it. You guys probably know it a little better than I do. Just can't do those things anymore without work.
Right. Yeah. Or like I said, if you have a surgery and a nerve is damaged, it can affect things as far as swallowing too.
So this is not just when I think speech language, I'm speaking voice, speech, but there's so much more involved in that.
Yeah, absolutely. Like she said, swallowing is a big part. Voice, you nailed it. We do a lot with the muscles, the same muscles that you use to swallow. They're the same ones that you use to talk. Exercises, coordinating your breathing, your vocal cords, all the muscles together.
Now, we talk injuries, we talk stroke, but there's also just kind of getting older and some things that happen to us once we age. And one of those things, dementia with Alzheimer's and all that, that also plays in a part. Now, obviously, there's no cure for Alzheimer's, but there are ways to slow the progression down and maintain the functions that you hold dear as long as possible.
Right. Yes. So with dementia, we would focus on home environment and caregiver training and maintaining, like you said, maintaining that ability that they have for as long as possible. And that includes their memory, but also their communication skills. So communication is so important to socializing. And sometimes we forget about that if a person doesn't have their memories, we communicate using those a lot. So we also work on making sure that person can communicate for as long as possible as well.
So let's talk about all the different types of people that could really benefit from speech therapy. We mentioned the stroke, Alzheimer's, things like that, but there's a variety of other reasons why you would need speech therapy.
Absolutely. Speech therapy, really a variety of neurological disorders, Parkinson's disease, MS, anything like dementia, post-stroke. Katherine had mentioned after a surgery, a variety of things. Swallowing, voice, cognitive-based therapies, communication. There's so much.
Now, I see one thing listed in the list I have in front of me is adapting and compensating, because it's sometimes those things are lost kind of forever, and you got to find a new way to communicate.
Yes. So especially with communication, sometimes that requires a device. So we help people find the correct fit as far as augmentative alternative communication, where they're using like a tablet or a computer, and we train them and the caregivers on how to use that.
Which, by the way, I think everybody associates Stephen Hawking, one of the most famous, with it, but you'd be surprised how much technology has advanced in that field.
Yes, everything keeps getting smaller, more compact. It doesn't have to be using a device necessarily. Even the earbuds have helped. A person can hear the communication device say it in their ear, and then sometimes they can repeat what that communication device is telling them. So even though they can't initiate that communication, they can use the device to help them with the initiation part and then speak the words on their own. So it doesn't necessarily have to take the place of that person's communication. There's lots of options, and technology's definitely come a long way.
So when should you contact after an accident or a stroke or things like that? Like, how early in this process do we need to get in contact with the speech therapy?
I think early intervention is best. As soon
As soon as possible?
As soon as possible. Yeah, absolutely. Speak with a doctor. They can contact us. You can contact us directly if you have questions on the process.
So what makes Salience different? Because I know there's people out there that have had various forms of speech therapy in the past, maybe it wasn't with Salience. What makes Salience different?
So at Salience, we do pride ourselves on giving individual attention. We treat everybody for a full hour. Some places you go, that doesn't necessarily happen. We also do mobile outpatient. So we will come to the person's home if they can't find transportation to us. Sometimes that's for a short period of time where they need that because they have been debilitated, and we can work them into coming into the clinic. So we have multiple options as far as service provision.
I see one of the things that you hang a hat on is experience, years of experience, because everybody is different. And especially in the medical field, everybody is different. And that really comes into play.
Absolutely. This is my 19th year actually practicing.
Well, you're only 22, so that's not.
Right.
Yeah, you're welcome.
Thank you. So, yes. And I feel like you just keep learning more and more every year. The patients I work with, I learn so much from them. We also really pride ourselves in the research and trying to keep up with the latest research trends and different therapy techniques to help the best we can.
And especially in a field where it's not only the therapy itself, but as you mentioned, the technology that keeps advancing and new things out there to try and just every day is a learning experience.
Absolutely.
All right. How do we get in contact with Salience?
The website, I know the world we live in, right? Salience Neuro Rehab.com is a great way. Otherwise, our phone number, 812-998-6176.
I got a list of myths that you frequently hear in front of me. So I'm gonna ask you a myth, and you give me your answer, I guess. So who wants to do this first? Either Katie or Catherine. All right, Catherine, you are the guinea pig. So here's the myth that you have heard. Nothing's wrong with my speech.
Well, that's where the education piece comes in. So we also address swallowing and cognition. Sometimes it's memory that we're trying to maintain or improve. Sometimes it might not be them. It might be their caregiver that we need to train. So just because something's not wrong with their speech doesn't mean there's nothing that a speech therapist can help with.
Now, this is just me speaking. I'm sure there are times out there where maybe the individual doesn't realize that there's something wrong with their speech. And this is where a loved one, someone close to them, is probably going to notice maybe before they do.
Yes. So especially with our Parkinson's population, Parkinson's, it changes the brain. So they actually hear themselves as loud as they think that they are. So a lot of times they think their caregiver or their spouse is becoming hard of hearing because they keep saying, I can't hear you, I can't understand you. But to themselves and to their brain, their voice sounds normal. And we do have a special program for Parkinson's patients called Speak Out. And it trains the patient to notice that in themselves and to use their respiratory power adequately. And like we said before, prevention is key. So when you get a diagnosis like Parkinson's or MS or ALS, you can give us a call and see what we have to offer.
So really,
you.
as soon as that diagnosis comes, call, please.
Yes. Yeah.
Early. You cannot be early enough. Another one, and this one may affect a lot of people out there, not to alarm anyone, but difficulty remembering things. People just kind of chalk it up, okay, I'm getting older, I'm just kind of, here and there. That can, no matter what your age, that can be a sign of something is going on up there.
Yes. So if you're forgetting your keys, right, that happens to all of us when we're on our way out the door. But if it's happening more and more, every day, a couple things you forget, it would be a good idea to look into that right away because there are things you can do to keep your brain strong. And we have those things in our toolbox and we can train you. And it might only take a few sessions for us to train you in what you need to do to keep your brain as strong as possible. It's a muscle too.
All right, now, Katie, you're not getting out of this without answering one of these. My main goal is to walk.
Yes. So when people come in and they're like, "Oh, I really just want to walk better," there's a lot that goes into that. You know, your body and your brain have to work together. Sometimes there's adaptive equipment, and you know, if for example, if somebody has a walker, well, sometimes people forget that they need to use that. So there's cognitive
Stubbornness may come into play too. I know some people.
Possibly, right. So, you know, it depends on the situation, but whether or not it is learning something new, whether or not it is doing some kind of multitasking type, trying to remember and do things, it's all taxing on the brain. The brain is involved in all those things. Input from a speech-language pathologist could help figure out maybe the root cause. If your legs are strong but you're still having trouble, is there possibly something more happening?
Again, the brain is connected to everything in the body, and it plays a big role in everything you do, from walking, swallowing, breathing, everything you do.
Yes.
There are therapies out there that can help stop the progression or at least delay the progression, or just a variety of different options out there. And again, for you too and everybody involved with Salience, always on the cutting edge of technology and the latest therapies to get people either back to their old self or at least maintaining what they have now, as they, because some things we just don't have a cure for yet. Some other things that we may have not have talked about that you definitely wanted to mention?
We do hold different certifications in case anybody is questioning whether to come to us or somebody else. So we also are both certified in Vital Stim, and that is an electrical stimulation device.
I was going to ask you because I didn't know.
So it's an electrical stimulation device specifically designed for the face and the neck. It can give us a boost while we're doing those exercises and make those more effective for somebody that has maybe a facial droop from a stroke or difficulty swallowing. It's specifically designed for those muscles. So we both are certified in that. We're also certified in the Iowa Oral Performance Instrument, the IOPE, and it is a tool that we can use to measure the pressure of the tongue so that we can make sure that tongue is really strong, because it's got a big job when it comes to swallowing. So those are a couple things that we specifically offer.
As Katherine mentioned earlier, there's the Speak Out program specifically for Parkinson's. And I have a certification for something that is called Lee Silverman Voice Therapy. Not just for Parkinson's, but for other motor disorders where somebody might have trouble projecting their voice and speaking with that volume.
Okay, so there's just a variety of things that can really be helped with therapy from a licensed speech language pathologist, and of course, very experienced at Salience. And this is, again, we stress one thing, is it's never too early to get a speech therapist involved, and it can really mean the difference on regaining some of those functions, or at least prolonging an illness that you're stricken with, whether it be Alzheimer's or Parkinson's or any form of dementia. And it's the brain. It's a crazy organ. It's what it's connected to and what it does. And if it's not functioning properly, there are ways to help.
Absolutely.
Let's go over a way. How do we get in contact once again?
Again, we have a website, SalienceNeuroRehab.com. We're also on Facebook. You can look up our Facebook page. We post a lot on there. Also, our phone number is 812-998-6176. And I also wanted to mention that we do also offer free support groups every month, one for MS and one for Parkinson's, and those are posted on our webpage.
Are these for those inflicted with it, or even the caregivers?
Yes, caregivers too, and those, and it's posted on Facebook. Sorry,
that's okay. All right, you got some swag there. What's up with that?
Well, to say thank you, we wanted to bring in some swag for you. We got
Sweet
our shirt for you, and we've got some information, some handouts for you, just a little bit about speech therapy here at Salience in general, and of course, everybody needs their own little brain.
I finally got a brain. You listening, Beezer? Finally got one. Right here. Well, thank you, ladies, so much for stopping by and talking about Salience. This is very exciting thing for anyone out there that may be affected with that. There's help out there. please get in contact with them. You're never too early.
This has been In.form on WBDC and 18 WJTS. Catch past episodes on our social media pages and our websites. If it matters to you, it matters to us. In.form.